Ma'am,
Progress.
excuse me, ma'am. Ma'am, Remisha Sharon is having some network issues. She just informed me. She said that she will join soon.
Okay, I see. Sure. Well, so as you see today, we are starting a new unit. So, so this is unit 3, which is called Instructions and Procedures. So let us focus on the first piece of information here. Here on this slide, you can see several pictures. They illustrate something which is happening in a hospital. And our task is to think about this. What is happening in the pictures? In the first picture, picture A, what are these people doing? Asna. Is Asna here? Hello? Okay. John Farvin, are you here? John Farvin? John Farvin minus. Hala Malik? Does anyone hear me?
Yes, ma'am.
Yes.
Okay, Hala Malik minus. Sultan, are you here?
Yes, ma'am.
Yes, please. Can you answer this question about the first picture, picture A? What is happening in the picture? What do you think?
I think the man and take him to a bed to rest or dress change.
One of them is a doctor, and the doctor is asking the patient to he invites him to take some procedures.
Bed.
Yes, to lay down on the bed, and maybe then they will do some procedures. Okay. Good.
Yes, ma'am.
Thank you. What about picture B? What is happening here, Simju? It's your turn.
Doctor or a doctor aspirant, a student is writing down the documents of thesis.
Perhaps she's taking a history. His history, yeah. Yay.
Yes, ma'am.
So good. And when do the doctors do this? Just to write down some information about patient before or after they have met the patient?
Sorry, ma'am, I didn't get you. Can you repeat it once?
When do they do this? Take the history before they have met the patient or after they have met the patient?
After they have met the patient, ma'am.
Yes, of course, because they've learned some information from the patient. So
Yes,
what about the next picture, Danish?
Yes, ma'am.
Danish.
The doctor and students are analyzing the patient, ma'am. Or operating or something.
Pay attention to the age of the doctors. How old
Yes.
are they? So
They're senior doctors.
and is there difference in age so between the doctors?
Yes, ma'am.
And who is examining the patient, the elder or the younger one?
The elder, ma'am. They're teaching the younger ones.
Exactly, you're right. Okay, so and the next set of pictures, let us listen to Ashwati.
Yes, ma'am.
So,
Here, the doctor is checking the checking. I think he has certain problem with his hand, so I think he is checking whether there is any problem with his bones or something while moving.
maybe taking his pulse, right? Mhm.
Yes, ma'am.
And the other people standing nearby, who are they? What do you think?
Will be the one who is holding his hand will be the senior doctor, and the other two will be the junior doctor who will be learning about the patient's case.
Mhm. Or maybe consultants or a nurse, maybe nurses.
Yeah.
Right? Mhm. And okay, so picture E. So let's listen to Taib Jabbar.
They may be discussing about
Yes. What about?
the picture.
So they may be discussing something.
Yeah,
They,
related to the patient.
I see. Okay. Mhm. They are colleagues, right? Mhm.
Yes, ma'am.
Thank you. Thank you. The next picture is for Labib. Labib, are you here? Labib minus Hepzibah.
Yes, ma'am. In this picture, I think that they both are doctors and they are discussing about some documents related to patient, I guess.
Mhm. And you say the bored doctor. Why is he
Yeah.
bored? I mean, why is he yawning? What?
Because I guess he was working overtime and then they are discussing about the further things about the patient.
Mhm. Maybe they are handing over the shift from
Yeah,
one
ma'am.
doctor to another doctor. Yeah.
Yes, ma'am.
Okay, great. So here are the just functions that the doctors normally do. And so a lot of just everything is happening in a ward in the pictures. So we should just focus on this word. The ward, as you know, is a separate room in a hospital, typically one allocated in a particular type to a particular type of patient. And so all this, everything is happening in a ward here in the pictures. And the question is, do you have any kind of experience in a ward when you were there for the first time, or experience that you do remember about being in a ward? Who can tell us about this experience? Ansila, are you here?
Yes, ma'am.
So do you have this kind of experience? Have you ever been in a ward?
Yeah, but not as a patient, as a bystander.
Okay, and what was it? So can you describe this experience?
But actually, I was not able to stand for a long time. Only one bystander is allowed.
Mhm.
Um,
Okay. So who else can describe your experience being in a ward?
Yeah, ma'am.
ma'am.
So please, your name?
Can I,
ma'am?
Yes,
Ma'am.
Shamisha, Shirin.
Yes, ma'am. Actually, I went to the hospital and I was a patient in general hospital. There were so many people in this ward with different kinds of diseases, and sometimes I thank God for giving me a less to say not a big to give me not a big disease. There are several people in that ward with high risk of diseases, and I could see that the doctors treat every person with proper guidance, and the nurses care, all the nurses cares or treated everyone equally in that hospital.
Thank you so much. Thank you so much. Okay, the other people, who else just wanted to share us with to share your experience with us?
Ma'am.
Please.
Yeah,
Yeah.
No? I see. Okay. Well, I agree that being a patient is a sad story, right? And so you say that it's very important that the doctors just are able to help the patients in their with their problems. Okay, and so everything, all the pictures that so in some of the pictures, we could see the so-called ward round. And you see that this is the definition for the ward round. This is a visit of a doctor in a hospital to each of the patients in a ward. And this happens every morning, just early in the morning, so that the doctors can see their patients, talk to them, and prescribe something, have a look at the analysis, these kind of things. And so here, when a junior doctor goes on a ward round for the first time, goes for a first ward round, so he needs to pay attention to several things. There are tips given to a doctor who goes for a first ward round. And the question is, why do you think each tip is given? Why are these tips important? Let us listen to Asna. Asna.
yes, ma'am. Ma'am, can you hear me?
The first one, read number 1 and say, why do you think this tip is important? Yes.
There is easy to know whether the patient is in which room.
Are you commenting on the first line, right?
Ma'am, yes, ma'am. It's easy to know which patient having what to say. And this is the patient.
You can help us. What other ideas do you have about the first statement? The other students, please.
When a doctor knows the patient name, the doctor can interact with the patient very easily and very friendly.
Ma'am, it is break the ice between the doctor and the patient. When the doctor and patient first meet, there will be some sort of discomfort in communication. To break that, may ask first a few questions like, what's your name? How you're feeling today? Is there any trouble in X-ray while sleeping? So they will ask some questions like this to make the a comfort zone between the patient and doctor.
Exactly. Thank you. Okay, and so let us listen to Shamisha Sharin. Are you here?
Yes, ma'am.
So statement B, please. Tip B.
Find out from the bed manage if any patients have been moved and tour. Sometimes if the one patient is discharged or moved to another place from one bed to another bed, sometimes the doctor can't notice that, and if this patient if the doctor comes to the same patient, sometimes there may be another patient and he can't properly read the medical records, and he lost the previous knowledge about that patient, and it may leads to several clinical errors.
Exactly, you are right. So very good answer. Thank you. So John Parvin, is he still?
Yes, ma'am.
Are you still? Yeah. So please see.
Check all the case notes, investigation, and so on are on the ward. So the doctors should check all the what are the conditions of the patient and how his health for covering many days. So through this he can understand the present situation of the patient and whether he is having any improvement in his condition and all.
Yes, you're right. Well, and let us listen to Hala Malik about statement. The next statement, please. D.
Invite a nurse who knows your patients to come on the ward rounds. The nurses are the patient who work with the patient more than a doctor. They will be in the ward around 24/7, or they may have shift in 2 shifts, that's morning shift or evening shift. So that time the nurse in first shift may have told all the information to the nurse in the second shift, and they have also updated in the electronic system nowadays, so they may know about each and every trouble that the patient have faced while the doctor was not around.
Okay.
So
so the nurses are even closer to the patients than doctors, right? So they know all the details. Okay, and the next is for Sultan. E, please, Sultan.
Yes, ma'am. Record case histories and results clearly and concisely. By this we can store our information, and this is very useful for the coming new doctors who has not checked earlier. This information very is useful for the students also, for the case studies, etc.
For everyone who deals with this patient, just to get the information. Yeah. Thank you.
Yeah.
And if we move to the next slide here, we are going to listen to some piece of information. This is we should complete the reasons given for each of the tips that we have discussed. And this is one of the experienced doctor who gives the tips to a junior doctor about the first ward round. And we should look at the notes which are given, the phrases which are given on this slide, and we should complete the phrases with no more than 5 words for each gap. I mean that we should complete the phrases that go after this. We should complete the gap which go after these phrases, not before. So let us switch on the recording, and you will tell me if you hear or not, okay?
Unit 3, Listening 1.
Do you hear?
Yes, ma'am.
Yes, ma'am.
So let's get started. Please make notes.
Unit 3, Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, And if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
So, have you got the information? Are you ready to complete the gap?
Yes.
Or do we need to listen for the second time?
Yes, ma'am.
Yes.
Okay.
Yes, ma'am.
So let's do it one more time. Now.
Unit 3, Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
Okay, so let us check what we do understand. And Sinju, please, what is missing in the first line?
In the first line, it is make sure to know the name and the place where the patient is, so that as you want to demonstrate that you are familiar with the patient.
Yes, okay. The next is for Danish.
Yes, ma'am. If we are going to rounds, always check with the bed manager to avoid wasting time around for running around to check the patients.
Looking for patients, especially it's important for specialists who do not know the patients so well as the other doctor. Yeah. So the next is for Shwati.
Yes, ma'am, that is CA so that you can fetch quickly.
You can, yes, you can refer to his history quickly. Then Taib Jabbar.
Yes, ma'am. We should take the nurse because they may be more knowledgeable about the patients than you. That's the doctor.
This is about what about? So
Nurses.
nurse. Okay. Thank you. So the next is for Labib, please.
Yes, ma'am. So in that way, you can access the information easily, ma'am.
Good. So we've got all the information. And
Unit 3.
So the question is, would you give the same tips to a junior colleague in this situation? Who can answer? The same tips. If you were an experienced doctor, and you were just talking about the ward round. I think yes. I think
Yes,
yes.
ma'am. We will give these tips to the.
Can you think of any additional advice? What additional advice would you give?
I would say be punctual, ma'am.
Sorry, will you repeat, please?
Ma'am, be punctual while doing these procedures, ma'am.
Okay. Why is it important?
Because if the doctor is not punctual, then it may affect the all procedure. If the doctor doesn't doesn't update the information about the patient daily in the concerned manner, it may affect the other doctor who comes for the next shift.
Okay, thank you. And there are some things that doctors should do before you carry out a procedure. So here, one of the things which is very important, obtain consent from the patient for the procedure. Why do you need to do this? Let us listen to Labib.
Yes, ma'am.
Yes, please.
Yes, first one is to obtain consent from the patient for the procedure. So if there is a surgery or somewhat like that, so yeah, so we must take the first of all, we must ask the patient if he is ready for the surgery. So that we must obtain the consent from the patient for this procedure, ma'am. Like that. And
Who else?
also,
Yes. Who else
and
can comment on this?
And also, ma'am, we must tell the tell the patient about the situation of his situation and all, ma'am. So we must consent him.
Okay, so the doctor should warn the patient about the things that can happen related to this procedure, right? So it can be painful. Okay, good. About the next line, let us listen to Hepzibah.
Yes, ma'am. Second point is introducing yourself. While we are a doctor, we must introduce ourselves so that the patients can contact us easily, and there are chances for more trusting issues, so that we can increase the trust of our patients if we give more details.
Good. And about the third line, please, Ansila.
Yes, ma'am. Yeah, we have to prepare the trolley, with BP apparatus to check the patient's BP level, sphygmomanometer. Then, some thermometer to check the temperature, and the medicine needed for the patient, and the files.
Okay. So that everything that is necessary to do this procedure is very close, right? So you don't need to go to another place for any instruments, any tools. Okay, good. Now let us look at this slide where we have some words related to a procedure. So these are instructions for a procedure. And there are several words given in different colors that we need to use in these steps, in these sentences, to complete the instructions for a procedure. So the words are prepare, mark, attach, wash, sterilize, drain, obtain, withdraw. Do we know the meanings of the words? Do we know what they mean? So, or any questions about the meaning of the words? Sorry. Oh, we've lost connection. So, yes, here. Okay, no questions. Let us then listen to us now. What do you think about the first line here? Which word do we need to use? The stylet.
Sterilize.
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 Please, what else can we do with the stylet? Can we prepare the stylet?
Ma'am, can you hear me?
Yes, we can. Can we withdraw the stylet? Also possible, right? Okay. What about the B line? Shamisha Shiril.
Withdraw 10 drops of CSF into the 3 specimen tubes.
So this is cerebrospinal fluid. These abbreviation stands for, yes. What did you say? Which word should we need here? Should we use here?
Withdraw.
Withdraw.
Obtain.
Drops of some fluid. So this is about liquid. So
Yes, ma'am.
if
Wash.
Okay, wash is no. Which word is better to use when we speak about a liquid? This is drain. Drain.
Drain.
Yes, drain 10 drops. Okay, now Ramisha Shiril. Ramisha Shirin.
Yes, ma'am.
So C line. L stands for lumbar vertebra.
That's the point between lumbar 3/4 where the needle is to be inserted. Mark the point between lumbar 3/4 where the needle is to be inserted.
Okay, good. So the next is for Jan Parvin. So
Yes, ma'am. Wash your hand and put on sterile gloves.
The connection is poor. This is wash your hands. It seems you've said wash your hands.
Hello, ma'am.
Yes.
Hello. Wash your hands. Wash your hands and put on sterile gloves.
Hala Malik, please.
Yes, ma'am.
So this is E.
Dash consent for the procedure. Obtain the consent for the procedure.
Okay, thank you. Then let's listen to Sultan, please. Sultan?
Yes, ma'am.
F.
Dash the area of the patient's back. Mark, ma'am. Mark the patient's back.
We've used mark in C. Mark the point. So choose another word. Who can
Prepare.
Prepare is possible. What else is can be used here in this phrase? Okay, prepare. Let's just agree with this. The next is for Sinju, please.
Touch the equipment on the trolley. Prepare the equipment on the trolley.
Okay, and H is for Danish.
Dash the manometer. That will be attach the manometer.
Attach the manometer. Okay, so let's have a look at the next slide and compare with what is given here. So here it is suggested to use withdraw the stylet. We were right about draining 10 drops of the liquid, then mark the point between lumbar vertebra. Wash your hands, it's obvious. Obtain consent, we were right. Sterilize the area of the patient's back. So sterilize because it's very important. And prepare the equipment on the trolley and attach with the manometer. So if we have a look at these steps of the procedure, let us just put these steps in the correct chronological order. What should we start with? Which step is the first one?
D. Wash your hands and put on gloves.
What about obtaining consent for the procedure? Is it done before washing the hands?
Yes, ma'am.
Yes,
ma'am.
Mm-hmm.
Procedure is done first.
First we obtain consent, then what do we do after we have
Prepare the equipment.
the equipment?
On the trolley.
Yes, this
Prepare the
goes
equipment
next.
on the trolley.
After we have prepared the equipment, we do, what do we do? We should attach the manometer. Okay, or wash your hands and put on sterilized gloves.
Attach the manometer.
Attach the manometer and then wash your hands. So we washed our hands. So which step comes next?
Mark the point.
Mark the point between them.
Mark the point or sterilize the area.
What's the area first?
Sterilize the area of patient.
Sterilize it. Okay, then
mark
you
the point.
mark the point.
Then mark the point.
Then
And drain the tank.
Drain tank
Drain
drops.
tank
Yes,
drops.
sir.
and
And last withdraw the style.
with
Withdraw the
the salad. Okay, what? What procedure do the instructions relate to? What kind of procedure is described here?
Action of cerebrospinal fluid.
Okay, this is just investigation which is done like lumbar, connected with lumbar. So this is puncture, right? Lumbar puncture. Okay. So let us have a look at the picture which is given here. A lumbar puncture, this is a procedure of taking fluid from the spine in the lower back through a hollow needle, usually done for diagnostic purposes. It is also called a spinal tap, and you can see here in the picture. So the patient, so the spinal cord is shown here, and the needle and the fluid, and the needle is between so the lumbar vertebrae right here. Okay. Okay, so you see that we have about 1 minute. So we are finishing our first session, and we need just a minute. So we'll meet in 10 minutes. Okay?
Okay, ma'am.
See you.